Well, it is that time, boys and girls, to take a look at some common medical questions. And joining us with the answers, as you do to everything, is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you for coming in today.
You're welcome. Good to see you.
Good to see you as well. Well, here we have a true or false question. Is it true or is it a myth that blowing air into a bag stops hiccups?
Yeah, that's one of probably thousands of remedies that we've heard through the years. And, you know, some of them work, but none of them work reliably. So what do you do? Well, remember, a hiccup is a spasm of the diaphragm that sucks air right through the vocal cords. And that's what comes with it. That's what causes that characteristic hiccup. So typically what remedies work are what's aimed at increasing the CO2 in the bloodstream. Why? Well, we don't really know, but that seems to work. So blowing into a bag for about a minute actually does work more reliably than some of the rest. Things like holding your breath for about 30 seconds, then blow it out smoothly over a course of about 10 seconds, that works as well. Drinking a cold glass of water very fast, that works. And then something else that has seemed to work more reliably is taking an ice cube, putting it on the side of your neck, holding it for about 2 minutes.
That's
and that seems to paralyze the vagal nerve, and sometimes enough to just abate your hiccups. So it works very well. So, but remember, I mean, the overwhelming majority of hiccups goes away in a few minutes. Rarely does it last more than a few hours. But remember that case we talked about before where a gentleman named Charles Osborne, it lasted 68 years. Went away 1 year before he finally passed away.
I couldn't
Poor
imagine.
guy. Are you kidding me?
Well, what I do, I drink from the other side of the glass. So you have to bend over to drink. Does that somehow or another increase the CO2? It works. I learned it on Sesame Street.
You know what? We've all heard that one. There is no science behind that other than the fact that maybe if it's cold and you drink it fast, it may work. But again, remember, anything you do, the majority of hiccups are going to resolve in a few minutes anyway, so you may tie it to some crazy remedy and you think it works. So keep that in mind.
All right. Well, on to our next question. This one a little more serious. What causes ringworm?
Yeah, well, a lot of people think, and if there's one thing I want you to take home today, and that is that it's not caused by worms at all, okay? It is a fungus, and the name of the fungus is trichophyton, and those are dermatophytes that are already present on your skin, but they're also in other areas, and they like warm, moist, dark areas, like in between your toes or in your groin. So when your skin gets infected, these fungi are very, very contagious. So typically, the infection can be passed skin to skin, but it also can be passed by using somebody else's comb, brush, using their towel, wearing their clothing, or just touching a contaminated surface. Now, it's one of the few infections that can be passed from pet to humans. So if you see your pet that has a bald spot or has the characteristic ringworm rash, do not touch it. Make sure you get he or she treated. The typical treatment, topical ointments. Some of the antifungals, remember, they need to be placed on for 2 to 3 weeks. People think they're going to go away within a couple of days. It does not. It takes at least 2 to 3 weeks. Okay? So keep that in mind.
All right. Thank you very much,
welcome.
Dr. Soria. By the way, you can hit us up on Facebook with your crazy hiccup remedies like mine. Thanks for being here. We'll see you next week, and we'll see you after the break.